Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. We are back for another new episode this week, but last week I had a fun guest. I had Alex from the Agenda Period with us talking all about menstruation. So if you missed that, I highly recommend it. It's a good listen, but let's talk about this week's episode. We're going to keep it going with the PMS period thing. So I'm doing a two-part series, part 1 today, part 2 next week, on common PMS symptoms. So the first symptom that we're going to talk about are cramps. It's also known as dysmenorrhea. If you wanted to look up the medical term and want to be fancy, that's what it's called. But for most people, it's called cramps. And cramps are caused by prostaglandins. So having more estrogen and less progesterone influences period pain in the amount of prostaglandins that we have. But what in the heck is a prostaglandin? Well, for menstruation purposes, they are hormone-like substances that will cause our uterus to contract. So prostaglandins are found literally in almost every tissue of our body, including our receptors in our uterus. So that's why when we take an NSAID, like a non-steroidal anti-inflammatory, these help with cramps because NSAIDs inhibit prostaglandin production. So when it comes to cramps, what is abnormal? I always tell my patients, and how I advocate all over the place, is that period cramps are normal, but they should be tolerable. When you're taking fistfuls of ibuprofen, this is not normal. Missing work is not normal due to debilitating cramps. You should be able to function normally during your cycle. So having tolerable cramps is normal. Anything outside of that, we've got something going on. And I highly suspect it's back to what I mentioned in the beginning. More estrogen and less progesterone will influence our period pain. So that could be an imbalance in your cycle. The second common PMS symptom is a heavy flow. So your flow is not supposed to be heavy. If it is, we need to figure out the hormone imbalance, and guess what? Fix it. So some common flow facts are the average blood loss is about 5 milliliters to 80 milliliters during a period. Just to put that in perspective, one regular tampon or pad holds about 5 milliliters. One super pad or tampon holds about 10 milliliters. And a cup can hold anywhere from 30 to 60 milliliters. So the average blood loss, again, is 5 milliliters to 80 milliliters during your period. So that's not per day. That's like the entire time that you are bleeding. So if you're changing your super tampon, 5-6 times a day, every hour, this is way too heavy because now you've exceeded that average blood loss. Other flow problems that you want to pay attention to are you soaking through your products every hour? You need to change. You're having to wear the tampad, as some people say they're wearing a tampon and a pad because they're going to leak. You're passing clots that are larger than a quarter. You're having to double up again to protect the leakage. I've heard women having to wear, diapers at nighttime because they just have so much blood flow. You actually have to restrict your daily activities due to the oopsies, like you're afraid to leave your house because you might have blood running down your leg. I literally have heard all of these things happen through social media. So I know that they happen, and you're not alone if they happen to you. You actually are carrying around backup undies or clothing just in case. So this is another red flag that your period is a little bit too heavy. And we want to make sure that we're not experiencing signs of anemia, which is too much blood loss that can cause, crazy fatigue, shortness of breath, some palpitations, etc. So again, take a look at how often you're changing your product, what product you have, and then how much blood it should hold. The next one would be acne. So do you tend to have clearer skin towards the middle of your cycle rather than the end? Do you constantly have an outbreak around your cycle? There's a couple different reasons why this might happen. First, estrogen and progesterone actually are beneficial for our skin. But if these drop or out of balance, this is when we say, hello, acne. Second, your blood sugar needs to be balanced. So if you haven't had your fasting glucose or insulin checked in a while, let's check this because those blood sugars can influence our acne. Sugar increases a hormone called insulin growth factor, or IGF-1, which in turn will worsen inflammation, our sebum, and keratin, which all contribute to increased acne. And then third, we always need to look at the gut. I actually had a conversation with a patient this week about her acne, and her cycle is actually, or her hormones are actually pretty well balanced. So now I'm looking at the gut. So dysbiosis or unbalanced gut microbiome, food sensitivities, SIBO, which is small intestinal bacterial overgrowth, can all contribute to increased acne. So what's abnormal when it comes to acne in your period? Really any acne at all. If you have the occasional, one little pimple here and there, I would think that that's probably normal. But if you're having a ton of acne, especially around your chin and jawline, this is a problem. The last symptom we'll talk about in this first episode of the series is fatigue. So feeling extra sleepy around your cycle, this could be due to several reasons. One, sleep disturbances. So if you tend to have sleepless nights or what's known as insomnia around your cycle, this is likely due to a sudden decrease in estrogen and progesterone. This is also why postmenopausal women have such a hard time sleeping. Secondarily, it could be due to stress and adrenal function. So this type of stress causes you to be moody and irritated. And third, it could be due to an inflammatory response due to the decrease in progesterone. As we talk about in our next series, like progesterone is very anti-inflammatory. So the best way to compare this type of feeling is kind of like a period flu. So when it comes to fatigue in your period and sleep, what is abnormal? Well, we don't want to sleep a wink. So if you're sleeping like hardly at all, this is a problem. Sleep is so important and our body is going through so much during menstruation that we need to make sure that we're prioritizing sleep. So if we're not sleeping, our immune system is also going to be compromised, putting us at extra risk for illness. So obviously, if you're not sleeping, you're going to have the increased fatigue. We also want to make sure that fatigue is not due to the anemia, possibly from that extra blood loss. So you can see how all of these symptoms can be intertwined together and why we oftentimes have more than one PMS symptom and not just one that travels alone. So if you're experiencing debilitating cramps, a super heavy flow, crazy acne, and you're so tired, we've got something going on. And the best way to figure out what's going on is to test your hormones. But if you're really not sure if you're experiencing any of these symptoms or have anything wrong with your period, I have a perfect period quiz for you to take. It's free, and you'll actually learn a little bit more about your cycle and maybe where some abnormalities are. So we'll include that link in the show notes, but I hope that you can take the quiz and learn something. And then of course, we'll be sending you more information about, what the results mean and what you can do for them. But my first thing that I do to figure out what's going on is I want to test and not guess. I can assume things are going on, but every body and everybody is very unique. So I want to see what's actually going on with you, and that's by testing your hormones. So you can ask your medical doctor, your gynecologist for, reproductive hormone testing around your menstruation or menstrual cycle. Or we have options available on our website. We have a Hope for Hormones program that is super easy. The test kit is sent to your home, and all you do is collect your saliva for a couple times during the day. You send the kit back, and then you'll get your results and actually a done-for-you educational result analysis. So basically, if you have high this, you're going to click here. It's going to tell you what's going on, and then it's going to let you know what you can do about it. So it's super, super awesome and in-depth about your hormones. And then there's also an option to book a consult with me. But That is if you want some, personalized, individualized care. But more importantly, I put this program together because women were not getting the care that they deserved or understanding anything what they needed to ask for, or they didn't have access to testing or anything like that. So check it out. If you have any questions, I'm here for you. But stay tuned till next week, where I'm going to talk about 4 more common PMS symptoms. See you then.